In a 3-2 vote this week, the bill to dismantle the Colorado Health Exchange passed the Senate Finance Committee. If ultimately approved, Senate Bill 3 would redirect healthcare consumers to a federally run option. The bill's supporters argue the Affordable Care Act hasn't lowered Colorado's healthcare costs, while opponents want to give the program more time to work through its kinks. Eric, your quick take on this: is this purely ceremonial because of the split legislature?
Yeah, I think it is. Two quick takes. One is it's likely not to go through the House. It's hard to imagine that it does go through the House. Second is these issues are ultimately going to be decided in Washington until Washington figures out what repeal and replace actually means. And as critical as I am, by the way, Dominic, of Donald Trump on issue after issue after issue, I'll give him a little credit that he has slowed down the express train on repeal and replace to try to figure out what to do here as opposed to rushing it like he did the executive order we talked about earlier. But Colorado is going to have to respond to Washington, not the other way around.
Joey, is this dead on arrival at the House?
Oh, yeah, absolutely. This is all political theater, and it's all aimed at 2018. You know, isn't it a bit much? We're going to throw 175,000 people out of insurance, which is fine. I mean, the health exchange hasn't worked great in Colorado, and it has been expensive. But we're going to throw those people onto the insurance market, and then in all likelihood next year they're going to have to go back into the insurance market again when Obamacare goes away. So 2018, this will matter then, but it doesn't matter right now.
Patty, what do you think?
Well, your question said it all. The federally run option, what federally run option? So you cannot throw these people into limbo again for a year. So you're going to have to wait to see what happens with the feds.
David, wrap it up for us.
Throwing people out of the Hickenlooper version of Obamacare into Obamacare Classic is not so great either way. Neither one is sustainable. They're going to, if nothing were done, they're going to collapse on their own anyway. They need to be replaced with something that can work over the long term. And then the direction is something that expands patient choice rather than constricting it.